I'm a molecular geneticist. My name is Damià Heine, Suñer, and I do diagnostics of the ATTRv gene, and I work in the genetics department. Well, all patients where there's a suspicion that they could have a wild type amyloidosis or a variant TTR amyloidosis, they are sent for a genetic test to see if we can find any variant or mutation in the gene. We live in the Balearic Islands. Most patients have a variant. If they have the variant amyloidosis, they have the V30M mutation. So initially, we only screen for the mutation in the second exon of the gene, and then if the clinicians think we should look at the rest of the gene, we do that. And in the case of the wild type cardiac amyloidosis, we usually do the whole gene. In the cases where we do not find this mutation, we can expand the test to the rest of the gene, or in some cases, if there's a suspicion of some other kind of amyloidosis, we can even do an exome test, testing all the genes of the genome. So in that sense, it's a multidisciplinary approach. If we have a continuous communication with the clinician, we can change the scope of the testing depending on what the clinician thinks. And on the other hand, once you detect a patient that has the mutation, then you have to perform family studies. So it's important for us to have in contact with other clinicians to continue the testing in the family, in that sense, and see if the person is affected, not affected, whatever. We have fluid communication with the clinicians, in the sense that they can always ask us to expand the test to other genes or to other exons of the same gene in case there is suspicion that the patient has a variant that we are not detecting. We collaborate with neurologists, with internal medicine, with cardiologists, with clinical geneticists, and we do the testing for all of these. So we have to have a continuous communication to see if what the results of the test are what they expected. And in terms of communication, we use simple tools like emails, telephone calls, or we see each other person to person. That's what we use. I think any multidisciplinary approach has to realize that genetics is really important. So I think they have to incorporate genetics into the team. And I think it would be good to have a clinical geneticist and a molecular geneticist that does the testing. So I think sometimes this is overlooked, and I think genetics should be part of the multidisciplinary team.